Hello. Thank you for being here. I am visiting from Pakistan. I come from Lahore, which is not very different from Delhi, though I haven't been out too much yet, but I hope to. My name is Umar Saif. I work as the chairman of the Punjab Information Technology Board. This is the Punjab on the Pakistan side, and head all the public sector IT projects in Punjab. Punjab in Pakistan is the largest province. If it was a country, it will be the 9th largest in the world. So I come from an academic background. I've been a university professor all my life. But in this last 1 year, which was my sabbatical year from the university, I sort of started pretending to be a civil servant. So while coming here, I had to decide whether I'm going to talk as a civil servant or as a college professor. So I'll start out talking as a civil servant, telling you about various things the government of Punjab is doing, which is all our advocacy policy work for a free internet, a lot of e-governance systems that we're developing for better law and order, for transparency. Much like India, we're building an open data platform, and so on and so forth. But I think what you like most is when I start talking to a college professor, which is the actual stuff that we've done. In this last 1 year, we built a disease surveillance system at the scale of the province of Punjab, which is about 120 million people. And I'm going to walk you through this. And the reason we started building this disease surveillance system is because Punjab was affected by one of the worst dengue epidemics in the world the year before last year. About 300,000 people were affected by dengue, out of which 21,000 people were confirmed dengue patients. Delhi also has a small dengue outbreak almost on a yearly basis. And Lahore had a big one in 2011. We had 16,000 patients just in Lahore. 352 people died in that year. So it was just a disaster that we were not prepared to handle. And we set up a helpline, and this is what that helpline volume of calls coming in looked like. There were basically two lessons. For one, we found out too late. By the time we found out that there's a dengue epidemic in Punjab, lots of people had already been infected, and all we could do was damage control. And two, there was no spatial planning. Much like India, Pakistan also doesn't have a spatial planning unit. There is no equivalent of a zip code. All you have is union council numbers, but a union council is about 10,000 households. So if you have an epidemic, you can't really localize it. What do you localize it to? So that was sort of also a fundamental problem that we wrestled with. What we ended up doing, though, was use two important Google technologies, and that's why I chose to talk about this, to track the epidemic in this last year, once we'd been hit by this epidemic the year before, and did it quite successfully. As I told you, the year before last year, we had 21,000 confirmed patients, 352 deaths. In this last year, we had only 350 confirmed patients and no deaths, which is phenomenal. Once you've had an epidemic like dengue, it typically stays on for a few years. So this was sort of just a human effort by the government to prevent an epidemic from happening. And we did several things. For one, we'd set up emergency helplines that people could call in, get awareness about a disease like dengue. We also started doing surveillance in all major hospitals. We started monitoring all the prevention activities. That's largely what I'm going to talk about. We started geotagging all the positive dengue larva reports that were coming through, which could contribute to an outbreak. And we also started geotagging all the confirmed patients and started running early epidemic prediction systems to see if something's going to develop into an epidemic. So essentially what we wanted to do was to sort of try and catch the epidemic early before it sort of develops into something serious that we then can't handle. What we started doing was, for one, we had the entire government kind of geared up trying to do different prevention activities. These were about 1,500 different field workers, field officers who were doing prevention activities, from the Department of Health to the city district government, to the fisheries department, to the solid waste management companies, so on and so forth. And every day, the chief minister would take a meeting at about 6 a.m. and would ask the secretaries of different departments to present their progress from the previous day. And what that typically entailed was a series of pictures presented in a PowerPoint presentation of the various activities that they had performed to avert a dengue epidemic. So those pictures worked quite well. In 2011, the Chief Minister was pretty convinced that people are doing their work. But once they started showing the same pictures in 2012, he became quite suspicious. So he said, these pictures have timestamps, but they can be manufactured, and I don't know where these pictures were taken, so I'm not convinced whether this work was actually done or not. So that's when the IT department was interested with developing a monitoring framework that would let us monitor the prevention activities. And in that, we developed an Android application and bought about 1,500 different Android phones for all the field workers and gave out these phones installed with this application and asked them to take a picture and geotag every activity that they performed. So what we had at the end of that, and I'm going to now be more of a college professor and move to the real life system that we had. So we give out the Android phones with this application installed to our field operators. And it was pretty sad in the first 1 week. This is how it looked like in the first 1 week. Basically, nothing came through. This was an added chore for a lot of people to do the prevention activity, and we weren't getting a lot of data coming through. But at the end of the dengue season, this is how Lahore looked like. All these little pins, if you see them on the screen, are different prevention activities that were performed by different government departments. They were taking a picture of before they got there and performed their prevention activity and then took a picture of once the work was completed. It showed which agency, in this case the Lahore Waste Management Company, performed the activity, who did it, what kind of activity, date and time. All of that was time-stamped by the application in our server, so it's something that you can't fake. And I can keep clicking on these and you'll keep seeing, sort of the before and after activities of these. But at the end of the season, you'll notice that there are about 48,000 different activities that were performed in a period of 3 months. This is phenomenal work, by different government agencies coming together trying to avert another epidemic, but also, really reaffirmed our faith in the use of technology. These were people who otherwise would not use computers and PCs in their offices, but were happy to carry an Android phone to the field and take a picture of what they were doing. This is how Lahore looked like, if you're familiar with the geography of this region. But if I zoom out, you'll see how Punjab looked like, and these are all these little clusters of different cities in Punjab, where different teams were working, performing prevention activities, and were geotagging them using their Android phones. And we were tracking all of this in real time. The other thing that we started doing, and we had a late monsoon in Lahore last year, was that once we started getting confirmed dengue patients, we asked the entomologists who were in the field looking for dengue larva, which is a special kind of mosquito that could carry the disease. We asked them to also start geotagging all the instances of positive dengue larva reports. All the red pins here are positive dengue larva reports. These are all these mosquito larvae that spread the dengue epidemic. So they were geotagging all of that. So the red pins are that. And then once we started getting confirmed patients coming to the hospitals, we had a protocol where someone from the hospital will go to the house of the confirmed patient and would geotag the house. This circle is a 1 kilometer radius around the house of a confirmed dengue patient. That's typical flight radius of a dengue mosquito. And you'll see a huge correlation of the red pins, which is the dengue larva, and the confirmed dengue patients, right? And all of this was also being monitored in real time. So then we took this data and fed this into an early epidemic warning system. This is a spatial temporal statistical analyzer, similar to the one that's used by CDC in US, the Center for Disease Control. This takes confirmed dengue patients coming in, statistically analyzes that, and sees if there's sort of a spike, an unanticipated spike in disease in certain locality, and would flag that as an epidemic. So it gives you sort of a heads up of 2 to 3 weeks before an outbreak develops into an epidemic. So this is how the dengue season in Lahore in last year looked like. So this is a little slider at the bottom of the screen. As I move the slider, you'll see different outbreak alerts that the system generated over this period. We'll take these outbreak alerts, talk to the field operators, tell them to go to that place, fog spray it or use chemical elimination, look for the dengue larva or eliminate it. And this went on, for those few months as some of these alerts were generated and were communicated to the field teams. The last thing that we did, which was also interesting, this actually didn't take us much to develop. The early warning system was the crux of the work that we did. was this tool which worked a lot like a PowerPoint presentation, but was a tool that the secretaries were using to present to the chief minister their prevention activities from the last day. So instead of using PowerPoint, they started using this. What it does is it tells you where the activity was performed and the pictorial evidence of that. And you can run it much like a slideshow, and it'll show you where the activity was performed, and will timestamp it, and who did it, and where, and so on and so forth. And it'll also show you the picture. So this is essentially, sort of the tool that, the government was basically using to present their work to the chief minister. You can forge timestamps in it, and it will tell you also where the work was performed. So having all of this, was pretty successful. We could track all the work in real time. We could also, we could track all the dengue cases coming through, run it through an early warning system, and perform all these, and then perform these prevention activities in real time. So this is essentially how the system looked like. This was pretty unprecedented at government scale to use something like this. MIT Tech Review did an article on this. We've had a couple of research papers come out of this and so on. And now we've made the system open source for the governments to use it. Actually, I think folks at IIT Delhi have started looking at it for the little outbreaks that you get in Delhi year after year. We've now also started working on sort of taking our national ID cards, which is very similar to the UIDs that India is experimenting with, and trying to sort of knit a spatial structure of Pakistan by just free-form text. This is addresses at the back of the national ID card, to see if we can build a interactive sort of spatial structure of Pakistan, which you can query to find out where someone lives. If they tell you the street address or the house address, can I somehow figure out how many houses are there in a street and how many streets exist in a town and so on and so forth. And we have now finally also started analyzing the CDR data, the call data records of different people, where they move, how they call. This is anonymized, but you can take this data and start analyzing it, because analyzing it for diseases that are debilitating in nature, like dengue, because they affect your mobility pattern, and we know which people you typically call, where you move around and so on and so forth, and where you are most likely to spread this disease. So having all these pieces in place, we finally have sort of a disease surveillance system at the scale of the 9th largest country of the world, which was pretty successful in the sense that we didn't have any deaths last year. Thank you.
Umar, if you'll just stay there for a minute.